Thank you, Mr. Chair. And, it's interesting listening to the panel, and I agree that this is a global pandemic. So all of our panelists would agree this is a global pandemic. They can just voice yes. All of them agree that we need to have immunity. And we know that we can acquire immunity through two different sources, one through vaccination, and the second way that we can acquire immunity is through infection-acquired immunity, which we have heard discussed already. It's frustrating to me to hear that the response from some of our panelists is that if the United States forces the U.S. companies to give up intellectual property rights and patent protections to allow more dosages to be developed, one is that are there facilities that can develop vaccines immediately and with the safety requirements? And then two, is there a public health infrastructure in order to deliver vaccines? And three, while we're waiting for this, individuals are developing COVID-19 and developing immunity. So perhaps talking about immunity would be extraordinarily helpful. And one of the greatest problems today that we see and I see, I've been told for over a year to listen to the science, and I listen to the science, but I see that there's a lack of evidence-based decision-making from the Biden administration. And one example of this is what's happening in schools. President Biden promised to support a return to safe learning as quickly as possible. Yet, even as the teachers were prioritized for vaccines, they refused to turn to in-person instruction. Students' learning loss due to remote or hybrid learning is astronomical, and we just had another publication about that this week. Failing grades are rising and child suicide rates are surging, and yet some schools remain remote or hybrid despite no scientific basis for this decision. And we heard again this week that schools in certain states are going to go back to hybrid learning because of the Omicron variant, which to this point has had very little fatalities. In addition to which, when I was touring in some areas of my district yesterday, I learned that one of the school systems in a rural area closed down for a week for mental health reasons for the faculty, not for the students. And that put a burden then on those individual childcare providers and parents who were in that school system. So for even those schools that are in person, many are forcing children to wear masks, even though there is no study that shows masks on their own provide any additional protection for children. Dr. McCary, do you have any studies which show the efficacy of masking children in schools?
No, the topic of masking children has not been studied with any formal randomized controlled trial. And the data that we're relying on are really from adults, and that's the largest cluster randomized controlled trial was conducted by researchers at Stanford University. And they found that basically a cloth mask had almost a negligible benefit. A surgical mask had a roughly 11% reduction in transmission, and higher quality masks were higher. Now, I don't love that study design, but it's all we have to work on. And basically, we've imposed the covering of faces of 52 million school-aged children with very weak data.
And are there some evidence-based consequences of masking children in schools?
Certainly, if you talk to those who are speech pathologists, guidance counselors, if you look at mental health disorders in kids, it's got to play a factor. And the Brown University study that showed that developmental aspects of childhood are being significantly hindered in those who have gone to school during the era of masks being worn in school. That was very validating to many frontline people who have had concerns. Some kids do great with masks. Some kids struggle. A quarter of kids wear glasses, and it fogs up the glasses many times. So it's easy to say my kid does well with the mask, and therefore everyone should wear it. Come to inner city Baltimore and take a look at the kids who are not in school or in school wearing a mask and trying to learn on an iPad with glasses on. It's an entirely different situation than somebody who's got private tutors for their kids in the Hamptons with a $10,000 Zoom suite.
And Dr. McCary, like you and like our other panelists, I'm fully vaccinated. I've given vaccines in all 24 of the counties in my congressional district. But I think we brought up a very important point in this hearing is that I've asked Dr. Fauci and Dr. Walensky on hearings of this subcommittee. We had 5 public health experts just recently in this hearing, asked them about infection-acquired immunity, asked them about the Israeli study, And all of them were less than supportive of evidence-based data that has come out about infection-acquired immunity. I put forward a bill to mandate all insurance, both private and federal, cover for serology testing for humoral antibodies and also T-cell antibodies, because we know the T-cell immunity is stronger and lasts longer. But yet, as you're indicating, when we're talking about trying to globally vaccinate countries, we're vaccinating now children 16 to 17 and recommending boosters for individuals who may already have immunity rather than recommending testing for that. We don't know in children because the CDC, and I've asked this of Dr. Walensky, for those children who have died of COVID-19, what were their risk factors? What were their vulnerabilities? That's information that we should know before recommending that every child be vaccinated from the ages of 5 to 12 or 5 to 11, and then recommending boosters. Because as I think you indicated, would you agree, those boosters could be doses that could go overseas to other countries in order to increase the rates of immunization?
Gentleman, this time is